The workup that was done for the patient is very appropriate. Actually, I'm very happy to see that the patient, other than the MRI, did have a biopsy. Biopsies are very critical. We definitely should not treat patients with extensive disease without knowing really what they have. Biopsies nowadays are critical for HCC because, number one, we want to make sure that we're really treating HCC, not necessarily that things might look based on LIRADS as HCC, but sometimes they might differ. Add to this, in about 10 to 20% of the cases, a combined HCC plus cholangiocarcinoma can occur. And add to this also, some genetic evaluation of the tumor can be helpful. It's not necessarily up to gear in HCC compared to other diseases, but nonetheless, some choices of therapy might be really driven by the general evaluation of the genetic makeup of the tumor. With this said, again, imaging could be a CAT scan, chest, abdomen, pelvis, a CT of the chest, MRI of the abdomen, pelvis if patient is allergic to contrast or despite intervention, or if it's a preference. These are all good, and of course a biopsy is appropriate per se. No doubt that the patient did very well on the embolizations that happened 3 times. Truly, in general, we don't have a limitation how many embolization or how frequent should they happen. Maybe I would say short of Japan that really have defined a little bit of guidance in regard to how many and how frequent. Nonetheless, I think reasoning is very important to make sure that the patient, if they are benefiting, by all means do it. But if the recurrence of the disease happen rather more frequent in between the embolization, or they require so many embolization, time to really talk to other experts in the field. And this is really what brings in the multidisciplinary approach to therapy and to the management of patients with HCC. This requires the involvement and the contribution of the hepatologist, the medical oncologist, and of course the interventional radiologist, and of course if there was a resectable disease, the surgeon, transplant surgeon if needed, and many others as well.